So I'm really pleased to welcome Judy Chang from INPUD to a Corona Conversation. And today is Friday, the 27th of March. So Judy, could you tell people where you are now and what you do for a job?
Sure. So I'm Judy Chang. I'm currently living in Milan, which is about 45 kilometers from Bergamo, which is a small town in northern Italy. I don't think many people would have heard of it before, but it's been around the news a lot because it's been known as the epicenter. So that's where most of the deaths are occurring. There's 3 airports in Milan. One of them is in Bergamo. So some people may have flown in there before. It's a lovely old town. There's a medieval center, and it's just horrifying to know that there's just so much death and destruction going on there at the moment. My job, I'm the executive director of the International Network of People Who Use Drugs. So obviously, one of my concerns with COVID-19, obviously I share the same collective fear and panic and anxiety as the global community at the moment, everyone, but also, of course, we know that in times like these, in times of crisis, that the most marginalized and the most vulnerable, such as people who use drugs, who are also criminalized, suffer the harshest consequences. So yes, I've been really we've been under lockdown here since May the 7th or 8th. So really trying to focus my energies since the lockdown to really see what we can productively do around COVID-19.
Okay. Can you maybe, given the fact you'll have a global perspective here, but I'm just curious, are you able to shed any light on what the response has been from the Italian government and the Italian drug using community to COVID in Italy where you are now? Yeah,
sure. So, with the Italian government, there were definitely cases climbing, for at least 2 months beforehand. I think, but don't quote me on this, I think the alert, I guess, happened around, or the first few cases started popping up around mid-January. But, I think there was a real, like we've seen in other countries as well, especially in Western industrialized countries, this idea that it won't happen to us and we won't be the hardest hit and we have the resources. So definitely the government response was slow. It was when I was in Vienna, actually, at the Commission on Narcotic Drugs, that we heard that some small towns in Italy that have been at the epicenter started to get closed, started to be shut down and under lockdown. But, I had no idea the whole country would be under lockdown. So the day after I came back from Vienna, I woke up and it was like, oh, at 2 a.m. the government announced like there's a national lockdown and nobody in or out. Which was, a huge shock because, I think it was in the periphery, I think, of people's, people living outside these small towns, it was mainly in the periphery. So you had like widespread kind of panic, even when the north was being shut down, people were like trying to escape like to the south and to Rome. So the government clamped down on that. And from like March 8th, they were like, okay, nobody can move anywhere. But there was still a lot of movement within the country. Since then, the government's been doing, issuing daily briefings, as we have seen all over the world. The government's trying to calm the populace and also, sharing information. It's been interesting being in Italy, during the lockdown, one of the first countries to lock down, because, there were lots of images going on around the world as well of people on their balconies singing and clapping the healthcare workers, as we've seen in the UK with the NHS, I think was last night. There have been also moments of community solidarity and people, a sense of we're in this together. Now, for people who use drugs, I think, I think there's lots of impacts of COVID and, we're obviously health, but also economic, also in our daily, social life. It's, changing everything. But for people who use drugs, I think the immediate thing was, how are we going to be able to access both drugs And secondly, you know, if we're in harm reduction services, right, and how is the government and the programs going to be able to both protect like our safety and our need to be able to access these drugs during this, you know, emergency time. So I am part of a treatment center in Milan, and I mean, I think they've dealt with it, you know, as best as they could. As soon as I came back from Vienna, March the 8th, just after the lockdown, you know, they started implementing safety measures. So, you know, social physical distancing, you know, only 1 or 2 people in the center at a time. All the harm reduction workers and the doctors were wearing masks. In the dispensary, you know, they always maintained the physical distance. There was distant, you know, hand disinfectant and places to wash your hands from the very beginning. So I think they've done quite well, and also been, you know, Italy's already had we have a policy of take-home doses. So I mean, that's been a good thing. And I've also, you know, other people have shared networks and through my networks, other people have shared information about how other harm reduction services are dealing with it. I mean, we did see some closures. So we've been really trying to push back against that and wanting the UN also, and, you know, authorities to stand firm that services shouldn't close, because we know that, you know, we're talking about physical distancing, but if you shut down services, like, people are going to be in crowded spaces and not going to be able to, you know, maintain or protect themselves. So yeah, that's really
so have treatment services increased the amount of takeaway doses that people are given in response to this to reduce congregation, for example?
Yes, I mean, I think, you know, there's always been, basically services will be allowed, like, under, you know, laws and regulations, like probably a maximum of, they have a maximum amount of which they can distribute, but that, you know, it's all kind of, it all changes from place to place, and sometimes it changes from client to client, you know, like because they do like supervised urine tests, and if you keep on having positive urine tests, they may cut down your take-home doses, things like this. So even in places where they're more generous, I guess, with the doses, there's still, you know, it can still be a struggle for individual, you know, people, and it may change across service to service. Like, there's never been, like, you know, very kind of stringent, wide scale guidelines that everybody follows. So I think, you know, the push has really been, okay, everybody should be getting at least, you know, weekly doses. And I think, you know, in some places, if you're on buprenorphine, there's less measures around that as compared to methadone. So with buprenorphine, like in France, you can get 1 month dose. In Italy, you know, you can also, after you've been a client for a while, you can get 1 month doses. So yeah, just really trying to push, you know, everybody to be able to get 1 month doses. Okay. Yeah, and that's been a big thing. And we've seen also, you know, we've seen peer advocates in India and Nepal, like, successfully pushing for this as well.
Wonderful. Can I ask, do you have a sense that those people who may have intentionally remained on what, as a prescriber, I would consider subtherapeutic doses to allow people to continue to use, do you think there's been a shift where those people now are seeking to increase their dose to build up their tolerance, reduce craving, to reduce their reliance on illicit supply? And if so, do you think that's a smart thing to do?
Yeah, I mean, that's the harm reduction guidance we've been issuing, both as INPUD, like some of our membership, Russell, Dr. Russell Newcomb and Cheryl White, like, we're really we're really quick to act in this, and in the, you know, in the guidance that they issued, you know, it was very clear that, okay, well, now, you know, everybody's you're gonna have to prepare for withdrawal. Or yeah, you need to prepare to enroll in your programs. So that's what we're suggesting. And also, you know, we're seeing some guidance from some organizations that are saying, oh, well, you know, you shouldn't be increasing people at this time because we don't want overcrowding of the premises. But, you know, we have to remain clear in that, you know, if you want to protect people who use drugs, they need to be able to access, you know, safe supply. And that means services are going to have to be prepared for people enrolling. And they're going to have to be low threshold entry, because sometimes, you know, with some centers, it can take a long time to be able to get on, you know, in the system, and you need to do all these urine tests and et cetera, et cetera. So, you know, we're trying to push as much as possible that everybody should be able to have access to safe supply, you know, immediately, especially during.
And of course, those are things that should have been in place before COVID. So it's rather bizarre that at a time of crisis, suddenly people go, how could we make treatment more acceptable and effective for people? It's like, it shouldn't take a crisis for people to get that. But because Italy have been under this for at least a month, I'm wondering if you've heard of any issues with supply chains for illicits and whether purity is going down, going up, whether dealers are offloading, whether people are stockpiling. What's your view on that?
Yeah, I mean, we haven't, it's definitely made it more difficult for people to move around and purchase drugs on the street. And obviously there's dealers, you know, that are less available now, because I mean, the drug market locally around here, you know, you'd go to, you know, open air scene and, you know, you can purchase it there. So, I mean, since COVID came, there's obviously less people around. So it's made it harder for people to purchase drugs and also to be on the streets. There was a story in the paper the other day in Florence about a man, like, to be on the street, you need self-certification. And he had written on his self-certification, I'm searching for drugs.
Okay, honest.
But anyway, he did unfortunately get a fine for that. But yeah, in terms of like supply chain disruptions and changes to the drug markets, we've heard of more harassment on the streets from police, but we haven't heard of like major changes yet. I think it's more for advocates. I think it's more like something that we're concerned about and looking, you know, ahead. But yeah, I mean, we haven't, I can also speak to the Italian drug user network here as well. I know they had released a statement about access to treatment services as soon as this happened. I know they also picked up on, you know, greater harassment of people who use drugs because there's police and army on the street, so they were worried about that. But in terms of, you know, changes in the illicit drug market, you know, that hasn't been, you know, prominently expressed as of yet, but I know it's a concern for people.
You describe increased police harassment. I mean, other countries we've spoken to have reported a reduction in police harassment because the police are otherwise preoccupied. And do the police really want to be arresting people when the courts are shut down? And do you really want to be sending people into prison when, in fact, at the moment, what we want to be doing is releasing low-level, you know, people from prison so they can have their freedom? But you think it's just the fact there's more police and army on the streets, so there's just more encounter. They're not targeting people who are using drugs. They're getting caught.
I mean, in Italy, there hasn't been the targeting, but there's just been more interactions with police and army on the street. In terms of like what that has led to, you know, I want to speak to like the Italian network first. I know it's something that they were concerned about. So in terms of details, you know, I think they'd know more of the detail. But, you know, we've also, I know in Cameroon, we also had peers there complaining that police were picking up people who use drugs and, you know, using excuse. So I think, yeah, there's just on both sides, right? There's the, potential for, yes, there's going to be less, you know, focus on carrying out the drug war and arresting people who use drugs in some, you know, jurisdictions, some places, some contexts, but in others, you know, it can be used, increased police and army presence, you know, will be deployed to, you know, potentially target people who use drugs. And I think just from our experience, of course, you know, always fearful of, you know, police and, just looking at history, thinking, oh, okay, well, this can be used to target. And I know, it's been used against, you know, sex workers as well, and any criminalized populations. There's concerns with chemsex parties. You know, you hear that, you know, well, in Italy, you know, we can't just get tested even if we're a little bit sick. You have to, you know, match a threshold. But then you hear of, people busting into, you know, sex workers and their clients and then, you know, testing them and then, you know, potentially criminalizing them. So yeah, it's a complicated situation.
In terms of groups having to adapt their existing harm reduction strategies, do you think it's more of a challenge for people who inject drugs or who smoke drugs? I'm thinking people sharing crack pipes, close proximity, that's one issue. And then my other worry is people now injecting alone and therefore perhaps being at greater risk of overdose. Are you seeing a differentiation between injectors and smokers in the way you're adapting your harm reduction information?
Yeah, I mean, that's an interesting question. I mean, you would have seen in the INPUD guidance, which we also collaborated with Matt on, and Matt was leading on that. Did mention that, yeah, I mean, smoking at this time with, you know, COVID's impact on the respiratory system does seem more dangerous than injecting. So we can't say we've seen yet that people have moved to injecting, like, because of that. But yes, I mean, that's, you know, I think with the behavior of COVID, it seems, you know, injecting is less of a transmission risk than, you know, sharing smoking equipment or smoking and personally damaging your lungs, and also like sharing smoking equipment. But at the same time, you know, like opiate use is also more dangerous because of its impact on your respiratory system as well, and it slows down your respiratory system. So
it's just normally we always talk about smoking being so much safer than injecting, but I guess even people who are sharing works, tourniquets, you know, they're still touching each other's kind of bags and such like. So it's all of a sudden smoking's no longer the safe cousin of injecting because of those respiratory harms.
Yeah.
The other thing I was really interested in is whether or not people are displacing to other drugs, so prescription medications, and what your thoughts and concerns are over people moving to the darknet and the potential risk of synthetic opioids like fentanyl coming into the illicit market.
Yeah, in the guidance that we issued, I mean, we definitely did suggest and make the suggestion that people move on to pharmaceutical drugs, like either for withdrawal or maintenance. So I think, you know, or to have a stockpile so that they can prepare for disruptions in the drug supply. Yeah, in terms of the saturation of fentanyl, or, you know, the entry of fentanyl into some places, it is definitely a concern. So I think you know, in all the harm reduction advice that we've both issued and both worked with the UN and trying, you know, getting them to include as well, is that naloxone is going to be incredibly important, and that harm reduction services should be making sure that peers and communities have access to naloxone and be given, you know, bulk supplies of naloxone as well, to prepare for the potential entry and, you know, saturation of the market with fentanyl. But yeah, I mean, there's just so many unknowns, right? And a lot of, you know, the fentanyl was produced in China. So yeah, also, yeah, but I don't think there's been enough tracking of the drug markets as well. And yeah, I say that for both the illicit drug market, but also for, you know, production and transport of methadone and buprenorphine. You know, if we're in this for quite a few months, and the long haul. And I know that, you know, some of the methadone in Europe, you know, was produced in Italy. So there was also concerns, okay, like with transport of the methadone, like how is it going to get out? So yeah, there's just so many unknowns, but which is why, you know, one of our messages is that, you know, the international community really has to be tracking this stuff. And yeah, I think with all of COVID, you know, the countries that have done their best is because they were planning and, you know, planning on the future and, you know, considering all the different disruptions of COVID.
How well versed do you think the drug using community is who use opiates in how to safely use other sorts of medications to manage their withdrawal or get them through? Is it myth? Is it fact? Or is it just trial and error?
Well, yeah, there's not much guidance, I would say, and I don't know much harm reduction guidelines in black and white. I think a lot of it is, word of mouth. You speak to people and like, oh, I'm going to be going through this withdrawal. Like, what in the market can I use that will help? And, there'll be suggestions. Oh, try this or try that. Especially in some countries where, it's easier access to over-the-counter meds. Yeah, or using, getting some methadone and like using it over 5 days to not get dependent, but to wean yourself off heroin. So I think, yeah, a lot of the advice would be through word of mouth and peers. But yeah, I haven't seen specific guidance on, how to use pharmaceutical drugs to.
Do you think it might be worthwhile having another one of these meetings with some other people online and maybe have that conversation so I can tell you as a doctor what I think works and how? I obviously can't make those recommendations, but I think a conversation between people with lived experience and someone who would have experience in prescription medications, would that, and then out of that conversation, maybe some useful things could arise in terms of when do you dose? What's the difference between a short acting and a long acting? Are benzos useful? What should I absolutely not avoid? Things like, pregabalin for me terrifies the hell out of me. I know that people like it, but for me, it's a drug that at therapeutic full doses, 300 milligrams twice a day, increases your risk of overdose through respiratory depression additively. And then at low doses, it reduces your tolerance to heroin. So that terrifies me, but there are other options that would be less scary. And I wonder whether that might be a useful conversation maybe to have with Matt and a few other people.
Yeah. I think that would be a useful conversation to have, definitely, in helping us, plan. Because yes, I mean, we did say in the guidance that people should plan for withdrawals, but it was kind of it, and then what happens after that, right?
Yeah.
And yeah, a lot of people obviously are going to be alone and doing this as well.
Okay.
And doing, trial and error. So I think medical advice on that would be helpful.
Okay. The final thing I want to talk to you about is that while everyone is just dealing with the chaos now and thinking how to minimize the risk to life, a lot of people are talking about COVID being an opportunity to fundamentally think about drug treatment and drug policy moving forward. And one of the fears lots of people have is that we will somehow forget the lessons that governments and treatment services are learning now. With your crystal ball, or with an optimistic hat on, 18 months down the line from here, do you think there will be fundamental shifts in drug policy and drug treatment because of what we've learned?
I can be both an optimist and a pessimist, but I'll go on the optimist.
Give me best case scenario.
Yeah. I mean, I think it's difficult. I mean, I think, I do believe in every crisis there is the potential opportunity to learn lessons. And I guess but it's like whether, I guess, that impact is sustained, right? And given that I do think COVID is going to be lasting for quite a large amount of time, if enough of those changes that we've had to make to the treatment systems, like if enough of them are sustained for long enough time and people don't see all the scary or fearful things that they thought would happen, such as like massive amounts of, diversion and et cetera, and the rest of society falling apart because people who use drugs, got takeaway doses that they should, or have treatment that's flexible to their needs, then yes, I do think that there is the potential to change treatment systems. And yeah, it's really sad that it hasn't been done till now, because they are really kind of practical, intuitive steps that you're like, okay, how do I make someone's life easier? You know, which I think, you know, because of COVID, like we are thinking about that more. And I think it's thrown up, you know, people that are vulnerable, who are isolated, who are living alone, you know, they're going to be most worse off. And I think suddenly that's at the forefront of people's minds. So I think if we can like push for the changes, which we have seen, like in India, they've been pushing for takeaway doses since 2013-12 and come up against resistance. And now what India is under lockdown the last 2 days, they've been able to like push through in some states, takeaway doses, you know, a week ago or something. So yeah, there has been that opportunity for, and I think if that's sustained, you know, long enough, and, you know, people, you know, get normalized, or that idea becomes normal, then yes, I think we still see sustained change. I mean, I hope we also see that with criminalization and decriminalization. I mean, yes, because of COVID, prison overcrowding, you know, we see all these UN agencies now talking about prisons. We've seen release of, you know, prisoners in Iran, even though it's supposed to be temporary. They say, and, you know, some states in the US, which has, you know, the world's highest prison population. So, and yes, there's been those statements, but we haven't thought, okay, well, why are people getting into prison in the first place, right? And a large majority of that, and large number of that, as we know, is, you know, because of the war on drugs. So yeah, I think it is forcing us to confront a lot of things and raising a lot of questions, and we're all under quarantine. Well, you know, so many of us are under quarantine, having more time to reflect. So yeah, I do think that there is the potential. Whether 100%, you know, whether it will definitely happen or not is up for question, but the potential is definitely there. And I think as advocates, you know, our responsibility is to, you know, recognize that there is that opportunity and you know, and push that lever when we identify, oh, look, there's a lever for change there.
I love the idea that you've said that if it lasts long enough and it becomes the new normal, then people will almost be reluctant to go back unless society fell apart, which it clearly won't do. And it's somehow finding the space to monitor and evidence that the world didn't fall apart. You know, people will be tracking methadone overdoses if there's more diversion, but at the same time, treatment providers want people to stay in treatment. They want people to be satisfied with treatment. They want to be able to get on with their lives, not be tied to a dosing window. And so economically, hopefully some of those changes may also be really attractive to governments, because, you know, one thing governments are going to be looking at in the years to come is how are they going to fill the empty coffers, and they will be looking for ways of saving money. And if we can show that more flexible drug treatment services not only are more acceptable and more effective, but save money, then actually governments might go, oh, and it's the right thing to do. You know, that will be an afterthought. You know, that it'll be an interesting thing to see which argument's the most persuasive. It won't be human rights. It won't be treating people with respect. It'll be economics. But you win the argument any way you can. Is there any kind of like final message you'd like to share with people who are using drugs at this time, other than that eventually it will pass? Is there anything people need to hear?
Yes, I mean, I think, you know, one thing that's really struck me that, you know, and it's kind of the foundational principle that I think peers or peers involved in peer networks have always known is the importance of organizing and sticking together and looking out for each other and protecting each other. You know, there's been, you know, difficult, I think, times in any organization and any, you know, networks, but I feel that, you know, under this crisis, you know, we really have been able to come together more and focus on things. And I think there are lessons in the way that we have been working that, you know, we need to, that can be applied to the whole world. And I think, you know, with COVID showing that, you know, it is connectedness that matters, it is solidarity that matters. And yeah, I think there have been amazing things being done by peers, like very, very quickly in this COVID response, you know, making sure that, you know, there's information to peers, you know, advocating for, you know, very practical changes that are gonna, you know, hopefully be positive changes that will hopefully be maintained. So yeah, I just think, yeah, the message is that, you know, we need to be sticking together more, you know, more than ever. And also, yeah, be able to show the outside world, like what can be achieved through community organizing and community solidarity.
And as always, it's the drug using community that operates to look after itself way before the government ever gets there. In this particular instance, it actually might be that community leading the government, and hopefully, as you said, the government suddenly realizing here are a bunch of people who are interested in their own health and well-being and understand how to mobilize their community in a really effective, responsive way. So I hang on to those hopes as well. I'm not going to ask you about worst case scenario, because we've already been living in that for the last 50 years. So I think staying positive is a good thing. One thing I'd ask you before you go, if at some point over the next couple of weeks you'd be able to interview someone from the Italian network about what life is like on the ground and share that with us, that would be really fascinating.
Yeah, no, I had a whole list of people that I thought would actually be good, and wanted to reach out to people here as well, obviously.
Amazing. In that case, Judy, thank you so much for your time today, and yeah, stay safe, and yeah, hope things in Italy are finally, you know, turning for the better.
Okay, thank you very much. And
right.
Yeah, how is Spain at the moment? I mean, Spain must be...
It's on lockdown. People are being pretty respectful of, you know, the shutdown. The shops are full of food and there doesn't seem to be any issues with toilet roll supplies. And yeah, I mean, I think they're responding as best they can, but I think they probably didn't look to Italy quickly enough for some of the lessons they could have learned. And that's part of the reason for these conversations, is for those countries who haven't yet got there. This is almost a warning. It's like, there isn't time, you know? Yeah, I think having your kids at home is always an interesting challenge, but yeah, we'll get through that. All right, stay safe, and thank you so much, Judy.
No, thank you. Bye.
Take care. Cheers. Bye.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for a fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine.